Today, on episode 829 of CXO Talk, we're discussing the intersection of health, data, platforms, and AI with Dr. John Halamka. He is.
Yeah, this is a very interesting podcast as well, and it is a very compulsive one as well. Being it is touching on how you can create solutions, digital solutions in the sector of health, and this is a very important sector. And if you want to know the big pharma are actually the drivers of health in the whole globe. So they develop, they innovate, they do drug discoveries, and for this they use a lot of technology. So that the most, I think, or the heaviest users, I would suppose, that is arguable, of digital solutions, and actually the ones who need it even most, because health is a very important part of the economy. So this is another podcast which is worth listening to, and I'm just gearing into it.
Seeks partnerships and collaborations with innovators around the world. And so in some ways, it's three components, which is how do you curate data and do so in a privacy protecting and ethical fashion? And how do you do it not just for one institution like Mayo, but globally? And we can talk about that. How do you engage with solution creators, small and large? And how do you take the innovations and place them into healthcare systems or others in our ecosystem, could be pharma, payers, et cetera, and do so with little friction? So in effect, that's my role. Simply curate the world's data, encourage innovators to build more faster, and place it in the hands of those who need it.
So you're aggregating this data, lots of data, you've built a platform, and as we talk, we'll get into the specifics about the platform and the kinds of data, but for what purpose? Why are you curating this data?
All of us have figured out over the last 2 years that predictive and generative AI will likely impact our future workflow. And the question, of course, is if you are going to create models that are going to do good for patients of the future, you better have a great curated data from patients of the past so those models perform as we expect them to. You should also have highly diverse data sets globally so you can validate and fine-tune these AI models. Because just an AI model developed in Minnesota may not necessarily work so well in rural Georgia. And so, as you say, it's not data for data's sake. It's creating a global federation of a distributed data network for the creation of AI that we hope is fair, appropriate, valid, effective, and safe. It's testing and its ultimate use and monitoring.
You are raising a whole bunch of issues. Can you start to drill in? What kinds of data are you collecting? You mentioned a federated model. Tell us about that. You mentioned or implied safety and security, privacy. Tell us about that. There's a whole bunch of very crucial issues that get wrapped up together here.
Again, having done this for 40 years,